Para sa GWorks sa maayong panglawas.
Davao de Oro Accomplishment Report. The province of Davao de Oro is a first-class province with a population of approximately 798,000. It is composed of 11 municipalities and 237 barangays. The province has 4 Davao de Oro provincial hospitals, 5 private infirmaries, 11 primary care facilities, and 246 barangay health stations. The province achieved 100% in the preparatory stage, 94.4% in the organizational stage, and 45% in the functional stage of the local health system's maturity level. Approximately 202,253 patients have already registered in the Consulta package. Through collaborative efforts and initiatives, the province of Davao de Oro was able to create a barangay volunteer sanitary inspectors program. Additionally, to capture the profiles of barangay health workers, the Provincial Health Office, in partnership with Provincial Information and Communication Technology Office, developed the Barangay Health Workers Information System. Furthermore, they intensified data gathering for safely managed drinking water, zero open defecation, and sanitation services through Kobo Collect. On September 5, 2024, the province of Davao de Oro, through the Provincial Health Office in partnership with the 11 municipalities, conducted the Universal Healthcare Summit with the theme, Healthier Together, Better Health Outcomes Through Universal Healthcare in Davao de Oro. Through the initiative of our governor, the Provincial Health Office conducted home visitations for patients discharged from the provincial hospitals. Additionally, to strengthen the referral flow of patients from primary care to the Apex Hospital, the province developed the referral manual for the 4 primary care network providers. To ensure sustainable environmental sanitation services in every community, the local Drinking Water Quality Monitoring Committee was established. As a result, there has been no diarrhea outbreak for 2 consecutive years in the province, achieving zero open defecation grade 1. To reduce the incidence of rabies, the province revitalized the Provincial Anti-Rabies Task Force. The province now has 8 animal bite treatment centers. Additionally, the Provincial Local Health Board lobbied for the establishment of a snake bite center at the Davao Regional Medical Center. To ensure the health and nutrition of mothers and children during the first 1,000 days of life, the province launched the First 1,000 Days program. Barangay nutrition scholars were also given recognition through an amendment to the existing provincial ordinance. The collaborative efforts of Barangay Nutrition Scholars, BNS, the Municipal Health Office, the Provincial Health Office, and other stakeholders have made significant strides in addressing severe malnutrition through targeted interventions. The province established adolescent-friendly health facilities, reducing teenage pregnancy. The Provincial Health Office, NCIP, and IPMR assist MLGUs in developing municipal and provincial health plans, ADF. Additionally, the province maintains a blood collection rate above 2.1%. The province crafted a communication plan for full health consulta registration, which resulted in a 115% increase in registration compared to the previous year. For our 4 Davao de Oro provincial hospitals, the province launched the Help Desk Plus. It aims to enhance support for admitted patients by providing financial and medical assistance. In addition, to ensure the availability of drugs and medicines in provincial hospitals, the province established the Davao de Oro consignment system. Furthermore, the province endorsed one of 4 provincial hospitals for renationalization. To ensure the welfare of our force multipliers in the barangays, the province is currently amending the Barangay Health Worker Provincial Ordinance. Also, to equip our healthcare workers, several disaster risk reduction management and health trainings were conducted. The province received several awards during the Department of Health Harmonized Awards 2024. Under the steadfast leadership and support of our beloved governor, Davao de Oro has achieved a remarkable milestone as one of only 3 provinces nationwide to receive the prestigious Bronze Award in the Campeon ng Kalusugan sa Komunidad. This recognition underscores the unwavering dedication and resilience of our local government, organizations, and individuals who work tirelessly to make quality healthcare accessible to all.
We love DDO, Davao de Oro. We love DDO, Davao.
Daghang salamat to all of us here in attendance. Maayong buntag, good morning, especially to the organizers of this Public Health Leadership and Governance Program, of course, to the UP College of Public Medicine, Public Health, and the NCPAG. Good morning to us all. I will just read out my narrative so I will not violate the 20-minute ah, restriction. So, okay. I'm very much honored to be here today to discuss some of the priority healthcare challenges we are currently facing. Despite our continuous efforts to improve healthcare services, there remain critical gaps that need urgent attention. Today, I will highlight five major challenges backed by key evidence. First is there is low fully immunized child coverage. One of our primary concerns is the low rate of fully immunized children. Currently, our FIC coverage stands at only 63%, which is significantly below the 95% target set by the LGU Health Scorecard. This gap exposes our children to preventable diseases and underscores the need for intensified immunization campaigns and community engagement efforts. Second, there's also high teenage pregnancy rate. Another alarming issue is a high incidence of teenage pregnancy. In 2024, the recorded rate was 51 per 1,000 adolescents, far exceeding the NOH target of 37 per 1,000 and the Sustainable Development Goal benchmark of 30.3 per 1,000. This highlights the urgent need for strengthened reproductive health education and improved access to adolescent friendly healthcare services. Our healthcare facilities are also under immense pressure. The bed occupancy rate at our four provincial hospitals has reached 315%, drastically surpassing the DOH standard of 80 to 85%. This congestion not only compromises patient care but also puts strain on healthcare workers and resources, necessitating immediate action in facility expansion and referral systems. Due to budgetary limitations, also, we are facing significant challenges in managing our hospitals effectively. To address this, we have proposed the renationalization of one of the four Davao de Oro provincial hospitals. This move aims to secure better funding, improve governance, and ensure the sustainability of quality healthcare services for our communities. Lastly, we're experiencing low enrollment in the PHIC Consulta program, which is designed to provide accessible primary health care. Currently, only 8.4% of the total population had their first patient encounter. This calls for stronger advocacy and awareness campaigns to increase participation and utilization of this important program. Addressing them requires coordinated efforts from the government, healthcare providers, and the community. By working together, we can bridge these gaps and move closer to a healthier and more resilient healthcare system. Now, our healthcare breakthroughs and innovations. Some of our key breakthroughs and innovation that are improving our province's healthcare system. These are initiatives aimed to address major health challenges and provide better services for our communities. First is the creation of our barangay volunteer sanitary inspectors. We established the barangay volunteer sanitation inspectors to help monitor and improve environmental health in our communities. This ensures better sanitation and helps prevent diseases. To profile our barangay health workers, we also created an information system for our barangay health workers. This allows better tracking of our health workforce. We also strengthened our data collection for safe drinking water, sanitation, and hygiene through Kobo Collect. That's a digital tool that helps us monitor and improve water and sanitation services. We also crafted our provincial communication plan for PhilHealth Consulta registration. Okay, the status of our health indicators. We take a look at our 2024 health indicators and see where we fell short of a national objective for health targets. Identifying these gaps will help us focus on priority areas for improvement. Our mortality ratio exceeded the NOH target, reaching 95 instead of just 90. This highlights the need to enhance maternal care services, emergency obstetric care, and prenatal monitoring. Infant mortality rate also rose to 18, surpassing the 15 target. Strengthening newborn care, breastfeeding support, and postnatal services is key to reducing this rate. Only 63% of children were fully immunized in 2024, far below the 95% target. We need to enhance vaccination programs and community awareness to increase the coverage. Our TB notification rate was at 362, significantly below the 523 target. So we must also intensify active case finding strategies to detect and treat TB cases earlier. While we identified these areas for improvement, we also had notable achievements in several key health indicators. First, we successfully ensured high prenatal care coverage, surpassing the target. Second, almost all deliveries were attended by skilled health professionals, ensuring safer childbirth. Third, high percentage of deliveries took place in healthcare facilities, improving maternal and newborn health outcomes. Fourth, we greatly exceeded the target, showing strong family planning adoption. Fifth, we surpassed the goal, demonstrating effective TB treatment and patient adherence. These achievements reflect the effectiveness of our healthcare programs, and with continued efforts, we can sustain and further improve these successes. Let's build on these strengths while addressing our challenges. So, right off the bat, I would like to express my deepest gratitude to the lead organizers of this public health leadership and governance program, to the Zulig Family Foundation in strong collaboration with the UP College of Public Health, the UP National Center for Public Administration and Governance, and the Tropical Medicine and Public Health Network. Thank you for this invaluable opportunity. Among the 4 provinces considered, you chose Davao de Oro to be part of a maiden cohort for this leadership journey, a privilege we deeply appreciate. This journey has allowed me to meet brilliant and masterful professors from your esteemed institutions. More than that, it has given me the chance to engage with my fellow governors, leaders who are bold in sharing insights, generous in imparting grassroots learnings, and deeply collegial in the way they conduct themselves during lectures and group activities. Coming from the judiciary, serving as one of the justices in the Court of Appeals before transitioning in politics in 2022, my exposure to health was largely limited to the well being of my family, my children, my husband, and our household. I never imagined the vast complexities of the health system beyond the provincial level, let alone at the municipal and barangay domains. However, with the enactment of RA 11223 or the Universal Healthcare Act, I quickly realized the formidable task at hand. As governor and health champion, the success of these reforms is heavily influenced by my ability to navigate and transform our province's health system. Thankfully, this leadership training has been instrumental in broadening my understanding of public health realities, equipping me with strategic approaches to address health challenges unique to Davao de Oro, while also learning from the experiences of my fellow governors. So, on lessons learned, for the most part, health has always been my top priority, and it remains at the core of my governance since I assumed office in 2022. I firmly believe that a healthy people create a healthy and productive community. The COVID-19 pandemic was a stark reminder of how health issues or health crises can stall every sector of society. Thus, strengthening our healthcare system is not just a necessity, it is an imperative. From our esteemed professors, I have gained invaluable knowledge, too many to mention in one speech, but I would like to highlight a few key lessons. For example, in Module 1, I gained a deeper understanding of my role as a governor in public health. The concept of bridging leadership stood out, making me realize that I cannot achieve health reforms alone. I need co creators, our mayors, local stakeholders, and communities to push our shared agenda forward. I also learned the importance of evidence based decision making, strategic thinking, and foresight in addressing public health challenges head on. We live in a VUCA world, and navigating leadership in such an environment is no easy task. However, the wealth of knowledge I have gained has reinforced the importance of leading and managing change, implementing innovations, and crafting compelling provincial narratives that will mobilize my co leaders and communities toward collective action. One of the most eye opening lectures was on futures and foresights, which taught me to recognize early signals of change, small cues within our communities that may seem insignificant but could shape the future of our health system. As to policy recommendations, the following are our recommendations to improve our healthcare system, focusing on governance, workforce efficiency, digital integration, and community health programs. So, for our internal recommendations, first, we plan to implement the Seal of Good Governance for Health. This will recognize and give reward to high performing local health units. Second is the institutionalization of barangay volunteer sanitation inspectors because this will strengthen grassroots sanitation efforts. Third, we will enhance barangay health worker benefits. Fourth, we will strengthen nutrition programs by updating PD 1569, or that is relative to barangay nutrition scholar welfare. And we will establish dedicated units to support victims of abuse and violence. We have this already, but we intend to, expand these facilities or units. For external recommendations, first is the centralization of two key building blocks under the DOH. Since the devolution of health services in 1991, LGUs have struggled with health workforce shortages and limited access to essential medicines and vaccines, compromising service delivery. While DOH has worked to address these gaps, LGU constraints persist. To ensure equitable distribution and sustainability, we recommend that these two critical components remain under DOH direct management, enabling better planning, resource allocation, and service continuity nationwide. Second recommendation is we should have an interoperable electronic medical records. Government mandated EMR systems like iClinics and iHomies often fail to meet the diverse needs of health facilities. Instead of enforcing a single system, we propose interoperability among EMR providers, akin to how banking networks integrated BankNet, Megalink, and ExpressNet. A national health information exchange will facilitate seamless data sharing across public and private providers. We improve continuity of patient care nationwide. We foster innovation and efficiency in health information systems. So we propose interoperability and not exclusivity. This should be the priority for better patient care and system efficiency. Okay, as to key insights, this fellowship journey with the Zwillig Family Foundation and the UP has not only strengthened my knowledge of public health, but also deepened my ability to analyze stakeholders, including political allies and detractors. Through tools like Prince analysis, I have gained a clear understanding of who provides strong support and who poses strong opposition, helping me provide strategic partnerships and navigate the complexities of health leadership. Healthcare is not just about delivering services, it's about providing high quality health service and empowering communities to identify their own health needs, map out solutions, and ensure that interventions create a lasting impact. In our own language, dapat dama ng ating mamamayan ang serbisyong ating ibinibigay sa kanila. This philosophy aligns with the DOH 8-point agenda, particularly its first priority, which says, and I quote, "Bawat Pilipino ramdam ang kalusugan." Similarly, my governance is anchored in a simple yet powerful mantra: government works. This means that every resident of Davao de Oro must truly feel the presence and impact of government services. That we do not just deliver programs, we ensure that they make a difference in the lives of the people we serve. So as I move forward, I take with me not only the knowledge and tools imparted during this leadership program, but also a renewed sense of purpose in leading Davao de Oro toward a healthier and productive people and a more resilient future. This experience has reaffirmed my belief that leadership is not about individual success, but about collective transformation. Together with our stakeholders and communities, we will prove that government really works, and through our shared commitment to public health, we will ensure that every citizen of Davao de Oro can truly say, Ramdam ang kalusugan. Thank you, and may we continue to lead with clear purpose, unwavering passion, and relentless resolve.